we really talked about 4 key projects, which were like prototype projects, which we've introduced as an alliance to demonstrate our approach, which has been about being able to do things quickly, flexibly, in an agile manner, which is why they're prototypes, to be able to create real change, particularly in areas of equality. And Lambeth is an inner London borough with a very high non-white population, a very high level of people LGBT, and over 150 languages spoken. So, and we have there are significant inequalities in the country around mental health. But for example, if you're black, you're 5 times more likely to be detained in a Mental Health Act assessment than if you're not black. So that's what we're trying to tackle. We've got these four projects and these 4 teams that we spoke about. They're all fairly small teams, they're all relatively small amounts of money, but the idea is to deliver something quickly in an agile way. If it doesn't work, that's fine, we'll move on to the next thing, and there's some things that haven't worked, but if it does, then we mainstream it, and we have the evidence then to demonstrate how it can make a difference. I'll hand over to Robert. Perhaps you can talk about one of the teams, which is our CAPSA.
Yeah, so CAPSA, that's the team that I work in, and it stands for Culturally Appropriate Peer Support and Advocacy. And what we primarily try to do is make sure that the person stays at the centre of the care and align everything so that the person's care is integrated fully and they can get the level of equity that they need, and they're seen individually and they get their individual care package. And also to our main aim is to lengthen their recovery, follow them on a recovery journey, but to lengthen the amount of time they might stay in the community outside of readmissions. So yeah, that's kind of what CAPS is about. Yeah, and Nozomi?
Yeah, I think what we have been learning after 5 years of all the changes and attempts and the failures and successes, there are some takeaway messages. One, we need different people. So we are part of the Living Network Alliance. So 5 organizations plus Black Strive and Healthwatch Lambeth. So we need to bring different people, not only those people like me who have been working in the system long. Then we're bringing new people, different people with different ideas, different ways of working can create changes. And as this process, there are some of the disruptions, conflicts, difficulties, having challenging conversations, which is inevitable. But then if we are committed to continue working towards shared visions, shared goals, we can overcome the differences and conflict. And these changes and time spent to overcome the difference to reach compromised positions can help us to have trust and relationship. And Robert told me that he's advocating for patients, but also he notices a lot of difficulties in staff end. So this is all about getting us together and make changes, and we have got some system in place for further changes.
Brilliant. So as you mentioned, there are obviously lots of diversity in the place where you're working, and as you mentioned as well, there are lots of inequalities, especially in mental health, and it's about the way that we can use those diversities to our advantage. And so one of the things that you tackled was improving the length of time that people spend outside of hospital. How did you manage to achieve that, and what was the way that you went about doing that in your project?
Well, I'd say the main way what we're able to do is to have really deep and meaningful conversations with a person, and allowing the person to feel that they are more than their diagnosis or their label, and find out, really try to get them to see intrinsically what, one of the biggest questions we always ask people is, who are you, or where were you before you had a mental health crisis? And get them back to that part of their identity, that part of their culture, the things that are really important to them. So I think that's what it is. It's basically, it doesn't just go along with mental health, it also goes along with physical health. So allowing people to realise that the more healthy routines they have in their life, the more they can thrive. And the other thing is giving people the language so that they can self-empower themselves, and the more empowered they feel, the more they feel part of their community and more integrated in that way. Yeah, sorry. Yeah.
I just wanted to add, that was really powerful. People are not their diagnosis, and it's a very cliche term, but being asset based, but it's not. Too often and for too long, we've just looked at people as their problem. So you've got schizophrenia or you've got this is your problem, and it's moving away from that. So it's actually what are the assets you bring, what are the positive things, what are the things you love in your life, and what are the people you love in your life, and it's focusing on those things, and that's the real important thing. And it's really hard to do that when you're under pressure of huge workloads and insufficient staff and insufficient resources that we're all facing. But it's trying to remind people of that. And when you see that, and when teams see that, that's so beneficial and becomes a really positive feedback mechanism and reminds people of why they got into that job in the first place.
Some people do actually have mental disorders with diagnosis, but actually problems that they can't stay in the community long enough are not always because of the diagnosis. So that's what we are trying to do. So in the background of all our work, there's always some data and also analysis and evaluations. So we need to know what problems each individual has, and a lot of these problems are not medical or clinical. So I'm a psychiatrist, but I may not be the best person to remove these problems or solve these problems. So we bring different people with different skills and different expertise. Then we can help people to remove the problems or get help early enough or prevent and help them to help themselves.
So it sounds like one of the really important things in this is bringing kind of humanity to what we're doing. And so often people, maybe in the past more so, have been kind of given a label, and then that's the way that we see somebody is just through the label. But it sounds like what you're saying is getting to know people as well as having the opportunity to be human in the team as well, and bringing that side of you. Having different skills and having different people involved in the teams has been really effective for you. So final question from me, if you were speaking to other people who are watching who also work in communities where there is a really diverse population, what would you say is one main thing that you have learned, and one bit of advice that you would give to them to help improve the way that they work?
I'll start off because I know the least about this, but what I would say is see the person in front of you and really see them and be your authentic self.
Yeah, I'd also kind of second that. I think it's the main thing is to actually listen to people and empathize with them, and being non-judgmental in the sense of they might make the choices that you want to do, but try to actually hear the person and hear what they're saying, because sometimes people feel as though they're not heard a lot, so that helps.
Only one thing, or one thing, a couple.
The most important.
So, one thing is, for example, humility.
Yeah.
So I may not be the best person for someone who is in front of me, so one thing. Second, to become part of the solutions, and the solution often can't come by one person. So part of the solutions by group of people, and do your best to contribute.
Well, thank you very much. Those are all really useful tips, both for people who are watching and people like me, who's a doctor in the early stages of their career. And the importance of listening is very important, I think, as well. And thank you very much. I've really enjoyed listening to you. And thank you very much for watching our video.